So, once you open the animals up, you got most of the work done, believe it or not. Sharks have a little more work to be done than the salamanders. But one thing you're going to want to do is just get rid of this belt here. And the bone clippers can work on that because you don't want to try cutting through all this plastic with your scissors. Also, frankly, your scissors are probably not the best things to use on the shark because it's so big and you'll be cutting through skin here. So, circling around to this pair of scissors, these are called blunt sharps for reasons that should be obvious to you. They're larger, they're more powerful, they'll be able to get through the skin easier. All right, so these sharks already have an opening. Just continue it, right? Why make it too hard on yourself? However, some of you are going to have a problem where you've got staples in your shark. Probably those of you who don't have chastity belts. So you don't want to leave those staples in there. You don't want to mess with them too much either because they're going to be sharp and rusty and all that. So basically cut them out. That's all. Don't pull them out, just cut them out. You don't need that muscle anymore. And just get it out of the way so you don't hurt yourself. All right, so continuing on, lift up on the body as you do this. He wants to help. Come right up to the coracoid bar and come down to around the pelvis. And we'll make a couple of transverse incisions so we can get in the body cavity. Now remember, this can be pretty nasty in here. So be prepared. A number of you will be channeling your inner Han Solos. Oh yeah, this is a bad one. All this color, that's latex that's spilled out of the blood vessels. And it can be a bit of a mess to deal with, especially if it's free. It's going to be sticky and all that. So remember, I warned you about that with clothing. So no one would have made a mistake of wearing white here today. You're not going to stay the shark?
Well, yeah, but I'm not cutting it.
All right, so here we can begin to see the organs. There are our blood vessels. And really, that's about all there is to this. Once you start moving the organs around, you'll see these peritoneal folds. That's what you want to get rid of. That's it right there. So you're just going to go in with your scissors and break away these peritoneal folds. Once you find the blood vessels, you don't clean them up anymore. They're too thin-walled and fragile for you to mess with. So it's basically just clearing away the peritoneal folds, and that's it. Identifying things, obviously. Your shark, Tomas, ate before it died, so you've got at least one food item in here that we can open up and take a look at later. Here's the very large liver. That's the right lateral lobe, medial lobe. See this little thing here that looks like almost like a deflated balloon right along here? That's the gallbladder. Here's the left lateral lobe. Obviously, stomach. Here we have the pyloric region going to the intestine. You can tell this is spiral intestine because the annular arteries and veins run right on the spiral level. So we come down here, we can see the rectal gland. And as we continue along here, we can see on the posterior abdominal wall, the pink here, that's the dorsal aorta. The blue here, post cava. All of this to the side is the mesonephric kidney. Now, whether or not you'll see the renal portal vein, which is in this groove right here, will depend on really how well injected your animal was. There's not much you can do about that. And look around definitely, because here's the testicle all the way up here. And if you look a little further underneath here, so you can see it. This one's not injected. But right under in here, you'll be able to see that it looks like a calzone. And that'll be the posterior cardinal sinus. So most of it's just cleaning away these peritoneal folds and tracing out the blood vessels. Later on, I'm going to show you how to go through the common coracoarcurals to show the heart, cut through the oral pharynx to open up the jaw so you can clean away the oral mucosa and show the arteries on the roof of the oral pharynx. But we'll do that after a little bit. You got a bit of work to do between now and then. All right, so we've got The bone clippers up here, well, we'll use those later, unless you're gonna use them for the, belt. I got the blunt sharps here, so I'll pass those over to someone, and I need someone's salamander.